Hey guys, this is Dr. Hub. Let's look at the androgen biosynthesis. So here it starts with the presence of cholesterol. So it starts with the cholesterol. The cholesterol, it leads to the pregnenolone. So there is pregnenolone. So the cholesterol, it leads to the pregnenolone. And this indeed it gives rise to the 17 hydroxy pregnenolone. So it is 17 hydroxy. So it is 17 hydroxy pregnenolone. So let's look at what are the events occurring during this transformation. So from cholesterol to pregnenolone, there is the cholesterol desmolase. There is cholesterol desmolase, and there is LH acting. So LH will be fastening this process. So when you're looking at the pregnenolone to the 17 hydroxy pregnenolone. So here what we have is the 17 alpha hydroxylase which takes place. So during this the conversion, the 17 alpha hydroxylase, it plays a role. Next is we look at the formation of. So we spoke about the pregnenolone from 17 alpha hydroxylase, it gets converted to the 17 hydroxy. So the 17 hydroxy pregnenolone. So this is being converted to the dihydroepiandrosterone. So it is dihydroepiandrosterone. So there is 17 hydroxy pregnenolone to the dihydroepiandrosterone. So what is the enzymes involved here? It is the 17 and the 20 lyase. So after the formation of the dihydroepiandrosterone, this is converted to the androstenedione. So this androstenedione, and this is again converted to the testosterone. So what are the steps involved here? From the dihydroandrosterone to the androstenedione, there is presence of the 3-beta hydroxysteroid. So 3-beta hydroxysteroid dehydrogenase. Next is the androgen to the androstenedione. So androstenedione to the testosterone, there is presence of the 17 beta hydroxysteroid. So 17 beta hydroxysteroid, and this is going to be the dehydrogenase. So androstenedione is converted to the testosterone in presence of the 17 beta hydroxysteroid dehydrogenase. So we were left out with the formation of testosterone. So this testosterone is being converted to the dihydrotestosterone. So there is dihydrotestosterone. So dihydrotestosterone. So the conversion here is by the 5-alpha reductase. So there is 5-alpha reductase, and it involves the target tissue. So this involvement of the target tissue.